So it's 7 o'clock, and we'll get started with our second Wednesday speaker series. This is Healthcare for All Washington. Tonight, we are welcoming our lobbyist, Lonnie Johns-Brown, and members of our policy committee who have developed our legislative agenda and have been tracking bills in the state legislature. We will introduce ourselves as we come on for some small group presentations. Let me start. I'm Ronnie Shure. I'm a retired pharmacist, and I volunteer as your president. You can volunteer too. Tonight we're talking with members of our policy committee who are volunteers. So here's a great example of people that are jumping in. We'd love to have you join us. So please consider that. We're posting a link to our website to the donate button. We have set a goal to raise $250 during this program. If you are able, even small amounts make a difference for us to continue this work. When you also can hit that donate button in chat and navigate to another place on our website, the Get Involved, that button, the Get Involved button, will have a place for you to volunteer and to join us. We have committees that are making a difference in spreading the word, communications committee, in organizing different outreach programs and fundraising. So if you are able to join us or interested in joining us. Also note that there is a closed caption button, and I'm trying to set that up now. Closed captioning. And I think that's on. So if you go to the button at the bottom of your screen, hover over the bottom of your screen, you'll see a button that says CC or closed captioning. And if you click on that, you can open up that information. And if you have questions, please enter them in the chat. We will allow time at the end of the meeting to read out your questions and provide some answers. So welcome. Thank you all for joining us. Today is International Women's Day, when we embrace a world that's diverse, equitable, and inclusive, a world where there's a difference, where that difference is valued and celebrated. And in that spirit, let's start this meeting with an acknowledgement of the people who originally settled the land on which we live today, and include them in that embrace. I'm participating in this Zoom meeting today from the lands of the Coast Salish people. Please take a minute to acknowledge peoples in the lands where you are joining us today. We acknowledge all of the ancestral homelands and traditional territories of Indigenous peoples who have been here since time immemorial. Our efforts to achieve healthcare for all include universal healthcare coverage for the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Duwamish, Muckleshoot, Puyallup, Suquamish, and Tulalip nations. So please take a minute to think about that from your place where you are joining us tonight. I mentioned that the program will be talking about updates in the legislative agenda that our lobbyist and our policy committee has developed, but we also wanted to offer an orientation or a deep dive into how the legislature works and how you can get connected. So we will be offering programs, and we'll put this on our website on March 28th, near the end of the month, in order to walk through ways to look at the state legislative website and to use Take Action Network to your advantage. So we communicated with you saying that this was like this legislative update equated to how making sausage is kind of a messy process, and we are seeing changes each step of the way as we move in to finding, as each agenda or each step in the legislature takes place and each cutoff occurs, we will see ways that bills can have to be adjusted. We will see amendments, and we will see bills that are not going to make it in this legislative session. So let me introduce and let's highlight our lobbyist, Lonnie Johns-Brown. She's had years of experience in working with state agencies, working with other advocacy groups, and it's just been a pleasure to welcome her aboard the team here at Healthcare for All. And she has been a real source of inspiration and has motivated us to move along with each bill. So Ron, if you could highlight Lonnie, we'll let her give an overview of where we stand before we talk about individual bills. So Lonnie, how is the session going?
Well, it's going pretty well. We are we're about 60 days into the 105-day session. And tonight we passed a really big major hurdle for bills. Every bill that was introduced has to have passed the House of Origin. So if I'm a House bill, I had to have passed the House by this evening. And if I'm a Senate bill, I have to have passed the Senate. There are some exceptions to that. The budget is a major one, and I'll talk about that in a minute. It's important to remember that we are, every state is different, but our state holds what is called really a biennial session. So this is the first year of what is really a 2-year session. So as we go through the bills tonight, you'll hear that some of them that we care a great deal about have not made it past this first big hurdle. But that doesn't mean that they're done. That just means that they might need a little work and can come back next year. Same bill number. Sometimes even have already been out of the committee. So that's just something to be aware of. We have a 105-day session because we're writing our biennial budget. So that's the reason they allow themselves that much time. Doesn't sound like a lot of time to some of us. If this was an even numbered year, we would have 60 days. Literally, these folks have introduced hundreds and hundreds of bills, and the process is set up to kind of winnow those bills down. We have a lot of new members. I think that's important to bear in mind. There are over 20 new members of the House, and quite a few less in the Senate, but the Senate is half the size of the House. Lots of new committee chairs, lots of folks who, even if they're not new, this is their first in-person session. So they're all, learning the process and learning how to do this in person. And they came in with certain priorities. Mental health is a big priority, and you'll see that reflected in some of our bills. Obviously, always cost containment. Balancing out some of the work that they've been doing around criminal justice issues remains a big priority. And then our state bolstering and protecting the access to abortion because of the Supreme Court decision is another big priority area. And all of these things have to be balanced as we move forward, not just with policy, but in the budget that they need to pass before they leave here on the 23rd of April. And the budget is really the biggest policy bill that they do, because it's really nice to pass good bills, but it's a lot more important to fund those bills. And we do not have the same kind of budget picture that we've had in the last 2 years. You know, we don't have an influx of new federal dollars. We are struggling a little bit. Our tech industry is laying people off, and our housing market isn't quite where it was. We're not out of money by any means, but they really are having to be much more thoughtful. And again, we have some priorities in the budget area that relate to the goals of healthcare for all that other folks are going to talk about. So a lot of things are still moving forward that are important to us. The budget, which is, again, as I want to say, the biggest policy bill they're going to do, we expect that around March 20th or shortly after, because on March 20th, the next revenue forecast comes out, and the budget writers are going to see what that says and tighten up their budgets and then come out with them. Each chamber will do a different budget, working off of the governor's. You know, he had to come out with his in December, and then they'll spend a good chunk of session negotiating until they come up with one they can all agree to. So that's where we are. And Ronnie, I'm looking to you to move us on to the next.
So let's talk about the budget issues first. Let's welcome Denny Dellwo from the Eastern Washington. So let's highlight or spotlight Denny and have him join us. And Roger Gantz from Olympia, another volunteer in Healthcare for All. So let's add Roger in here. And Denny, why don't you introduce yourself?
Okay, I'm Dennis Dellwo, previously a state legislator and was chairman of the Healthcare Committee in the House of Representatives during most of my term. We worked very hard on healthcare reform, but what we passed was then repealed by the Republicans that came into power the following year. And I'm continuing to work on healthcare reform, hoping that we can have a single payer system that will provide the coverage we need and provide it at a reasonable cost.
And the fourth person on this panel is Roger Gantz. Roger from Olympia, can you give us a brief introduction?
Yes, good evening, folks. My name is Roger Gantz. In my former life, I was the policy director for our state's Medicaid program. Had the pleasure of working with Denny on many issues related to healthcare reform, particularly for low-income persons. Since retired, I've been involved in consulting work with the American Indian Health Commission, and I'm now pleased to say I'm a member of Healthcare for All. And most recently, through the encouragement of our colleagues here, I applied for and became a member of the Finance Technical Advisory Committee. FTAC is the acronym you'll hear in the future. And that's an extension of the Universal Healthcare Commission. And we're involved with providing policy guidance to the Healthcare Commission, which will hopefully be the vehicle for helping us get towards a single payer system.
Great, great, great. Thanks for joining us, for each of you to join us. So let's start by talking about the primary budget proviso that Lonnie has been leading us on. We started middle of the year, or started early in the summer, to discuss the Universal Healthcare Commission funding. They have had part-time support staff. We would love to see them moving along quicker or more efficiently. And they've have a new, like Roger said, advisory committee that are requiring more staff support. So our budget was to build on what the governor had carried forward in the healthcare authority's budget, to add an additional staff person and to ensure that we have funding to hire and keep the staff that were already existing or assigned to this commission. It would be great to see this commission move along quicker or more efficiently. Lonnie, can you add anything about the progress? The budget bills are about to pop up, And we will be starting to ask for your support in making sure that they move along.
Well, I believe that we've already asked folks to weigh in and let the members of House Appropriations and Senate Ways and Means know that we have made this request. We have great champions who, Senator Kaiser in the Senate and Representative Riccelli, the chair of the House Healthcare Committee and member of Appropriations in the House, both agreed to put forward our proviso request for this added staff and to dedicate current allocations for staffing to the work of the Universal Healthcare Commission and the FPAC. And those provisos went in. We really won't know how successful we are until these budgets pop out, but we have good champions. We might want to, in a week or so, do another call upon you all again to just remind folks about why this is so important. It's not a great deal of money, but it's very well focused and will go a long way for us to achieve our goals. So that's kind of where we are.
And if you follow the link that we're putting in the chat, you'll get to our website. And so not only can you donate, but you can go to the legislative icon or button and find out the exact details about the amounts in that proviso. And we will be updating that as we go along. So that too is available on our website. So a second budget proviso is about health equity for immigrants. And I was hoping, Roger, you could give us a brief overview of where we are trying to support the groups that are creating that budget request.
Thank you, Lonnie. You'll see me smile because I think those of my colleagues who know me well know one of my weak attributes is briefness, but I will try. Just as a bit of background, Washington's best estimates are that our uninsured rate today is around 5.5%. That kind of accounts for a little over 400,000 people. I was looking at some recent information from the Kaiser Commission, and they rank Washington 14th in terms of the lowest uninsured rates in the country. Of note, Massachusetts was the lowest, and our fair friends to the south, Texas, had the highest uninsured rate. I think policymakers in our state realize, because of the major initiatives we've made in terms of expanding Medicaid through the Affordable Care Act expansion, our role in being national leaders in coverage for children, and the success we've had with our health benefit exchange, that a key element that's been missing or was in need of support to get access to healthcare coverage for immigrants. It's worth noting that estimates are that there's a little over 100,000 folks in our state who are lawful legal immigrants. They're not eligible for coverage because of their citizenship status. And another number to kind of keep our eyes on, of that number, there's about 29,000 who have incomes at or below the federal poverty, at or below 138% of the federal poverty level. It's worth noting that the 2021 legislature, in anticipation of the immigrant health care, gave something in the order of $3 million to the Healthcare Authority to prepare necessary changes in their information system and to begin to do work in developing their networks to be able to support immigrants for the 2023 fiscal year. The governor's budget included approximately $18.7 million in dollars to implement what we call a Medicaid lookalike program for adults. Essentially, the immigrant health program would look like coverage that our other folks get through our Medicaid program. And that coverage would be up to about 138% of the federal poverty level. The budget also assumes that the program will begin implementation not in July, but January of 2024. It's estimated that by the end of the first year, that is by June of 2024, there would be something on the order of maybe about 1,500 persons enrolled in the program, kind of a slow startup. But by the end of 4 full years, the current guesstimates are there would be a little over 7,000 people enrolled in the program. I want to add to this. I think it's important to note is that the governor's budget request, and I believe what we'll see through the legislature, is not what I would call a fixed dollar amount. In other words, they're not saying, well, we got, $15 million and that's going to be it. Rather, what they've done and will do with the legislature's budget is to make their best estimates about what take-up rates will be in the program and what per capita costs will be. This is, a new program for new target populations. So these are all estimates for that. I guess the last thing I would say is Lonnie had given us a note of caution to what we will be seeing in the budget this year. This is going to be a challenge for policymakers. We have reason to believe that this legislation, or I should say, this program enjoys support of leadership, and we have every reason to hope and believe that the amounts that the governor had requested will be seen likewise in the House and Senate's version of the budget.
Great, thanks, Roger. So those are budget provisos or budget issues that are increasing services, increasing healthcare as we move along during this year. But there's also this one bill or one Senate joint memorial that is asking the federal government to take action. Denny, do you want to share that information with everyone?
The state legislature has a variety of methods to contact their president or their legislators. One of the key ones is the Senate Joint Memorial or the House Joint Memorial. This is a method where they're able to give their feelings to the president, to the Congress, and both, it's joint, so both the Senate and the House end up sending it off to Washington, D.C. The Senate Joint Memorial 8006, what the staff has summarized it as petitions the federal government to create a universal health care program or partner with Washington State to implement a single payer system, health system. And this, in a very detailed method, well, detailed, but in a very clear statement, they're asking the president, the Congress, to pass their own universal healthcare coverage for the United States. If they don't do that, then give us the authority by a waiver or whatever method it takes to be able to establish our own single payer system. It's made it, this resolution has made it, memorial has made it through the Senate. It's now in Marcus Riccelli's committee, and I'm very optimistic it'll make it through that. But it'll do nothing more than let the president and the Congress understand that Washington State supports universal health care and that we want them to give us the power to pass our own legislation if they won't do it themselves. The vote was pretty much Democrat against Republicans. Republicans are opposed to a single payer system. And so anything that we do in that regard, we're going to probably end up having to do it just with the Democrats. But it looks like we will have this joint memorial sent off to Congress and to the president, and hopefully it'll just add another weight to the effort to pass some legislation for universal health care.
Thanks, Denny. So let's thank you, Roger and Denny, for leading us here. Let's move you back to the peanut gallery or the audience, and we'll pull in Emil so that Lonnie and Emil and I can address several bills that are having an impact on affordability, on healthcare costs, and on managing that. So, Emil, if we can spotlight you, and why don't you take a minute and introduce yourself?
Okay, hello everyone. My name is Emil Chang. I'm a practicing attorney specializing in corporate and commercial litigation. I was originally from Taiwan, and I traveled regularly for business trips in Taiwan, in which they have universal healthcare. So it's really interesting to see how that worked out for Taiwan. People there, they don't have to worry about healthcare. They all have this basic level of healthcare, and they are taken care of. So I thought it would be great if Washington State or the entire United States will have universal healthcare. And by the way, the spending by Taiwan on universal healthcare is about 8% GDP. And here in the United States, we spend about 17, 18% GDP, a whole 10% more that we spend here. So that's me.
So Emil, do you want to introduce the contracting bill that is in the House or the Senate, 5393?
Sure. Yeah, so I'm here to talk about Senate Bill 5393, which is called Addressing Affordability Through Healthcare Provider Contracting. I had no idea what that meant when I read it. But basically what this bill addresses is the rising healthcare costs due to consolidation of hospital systems. So as stated in the bill, that one of a primary driver of healthcare cost is consolidation of hospital systems, hospitals and hospital systems. So he gives an example. In Washington State, the top 5 largest hospital systems back in 2010 had 30 hospitals total. That's the top 5 hospital systems in Washington State. By 2021, 11 years later, the 5 largest hospital systems in Washington State has 49 hospitals. So that's a substantial increase in the number of hospitals held by these large hospital systems. So the purpose of this bill is to address rising health costs due to consolidation of hospitals in hospital systems. It does that by prohibiting some contractual clauses in the contract between hospital systems and insurance companies, insurance carriers. So it's really interesting. They are shifting the balance of the bargaining power between hospital systems and insurance companies. They do this by 4 different methods. One is called the first one is called all or nothing clause. So all or nothing clause is where the hospital system bundles their hospitals and clinics and services and require the insurance company to utilize all of them. With this bill, bundling is prohibited. It's not allowed in the contract between hospital system and insurance companies. The second one in which they do this is called anti-steering clause. Anti-steering clause is in which the hospital system, through the contract, would prohibit the insurance carrier from routing patients to competitors, and they want them to route it, I guess, to themselves. So this kind of steering of the patients is prohibited under this, if this bill passes. And the third way they do this is called the anti-tiering clause. Anti-tiering clause is where the hospital system requires the insurance company to place their hospitals in certain tiers. For example, in the lowest pricing cost-sharing tier, so that they will be more favorable, they will have more competitive advantage. And the fourth method in which is prohibited under this bill is where the hospital system requires certain pricing for their affiliates. That's not part of the contract. So in other words, the hospital system will say, hey, insurance company, you got to, for my affiliates, you got to set the pricing in some way. So, so this bill, these 4 different ways of contracting between the hospital system and the insurance company are prohibited under this bill. And in effect, this bill shifts the bargaining power away from the hospital system and to the insurance company. And this was seen in the public hearing for this bill, in which I took some notes in which we could see the doctors are against it. Obviously, the hospital systems are against it. Insurance companies are definitely for it because it shifts the power to them. And lawyers are split. One group is for it, another group is against it. So that's what this bill is about. It has passed the Senate Health and Long-Term Care Committee. It has passed the Ways and Means Committee, and it's in the Rules Committee right now.
And so that's certainly one small step, but each time we move one step closer, we can provide more care. And so we are certainly working as an association or as Healthcare for All Washington to reach universal health care. And we know that the solutions probably are a little beyond peony small changes, but each of these bills does make a difference. There is a bill to support the Healthcare Cost Transparency Board. There doesn't look like that's going to go through smoothly in the first part of the biennium, but it's to give a little more power to that board. And they have been meeting regularly and setting benchmarks. And there was a strong reaction to those benchmarks from institutions that are struggling with their budgets. So it's exciting to see legislators still bringing up those issues. So one other board that can have an impact on healthcare costs is the Prescription Drug Affordability Board. And that was passed last year, but the board has not been organized yet. So this was a bill to actually give a little more structure and support to that bill. You can find both of those bills about the boards in our legislative actions on our website. Peter is adding that link in the chat. You can go to our website and maybe bookmark it on your computer, and not only the donate button that you'll get bookmarked at, but also go over to the legislative button. And we've also kind of put the safe staffing bill in this issue of affordability. It's an issue for hospitals because of increasing costs for staff, but it also increases the outcomes in care. And that's what another big issue in affordability. If we can have good outcomes, then we will be doing worthwhile things. We will be saving funding in the long run. We will be treating patients at are providing better outcomes, and higher quality care will actually be the most affordable things that we can do. So, Lonnie, do you want to summarize anything more about those cost control bills, or any words of wisdom to wrap this section up?
Well, I will point out that 1508, the Cost Transparency Board, has gained some new abilities. It is being asked to do a study around underinsurance and whether or not there's a connection in some of that to the tax breaks that we give to a lot of nonprofits. So two-pronged, underinsurance and the effect of tax breaks. And then they also have the ability now for entities that are not meeting the cost containment goals that they set, provider groups, hospitals, et cetera, to be able to put them on a performance improvement plan. And if they don't meet that plan, fine them. So that bill did pass the House and it is over in Senate Healthcare. I expect it'll be amended some more. And then 5393 unfortunately did not pass the Senate today. So it's probably not going to see any more action this year. But as I mentioned, it can come back next year. Same number.
Next year. So Emil, we'll remove you from the group and bring in Ron Lovell and bring Denny Dellwo back in for a discussion, a last short panel to discuss another group of bills which are really dealing with equity, which is what makes a real difference in our healthcare system. It's not just about money. It's about improving services in several different areas. Ron, do you want to introduce yourself?
Hi, Ron Lovell, new resident here in Washington State, about a year and a half, but very interested in advocating for universal health care. And the bill that I want to talk about is House Bill 1678, establishing and authorizing the profession of dental therapy. Briefly, what it does is establishes rules around licensing dental therapists and sets requirements for licensure, the scope of practice, and the settings in which dental therapists can work. It allows the dental therapist to supervise dental hygienists and expands functions for dental auxiliaries and dental assistants. Dental therapists are already working in Washington State, thanks to the lawmakers and tribal leaders who in 2017 established through the Senate Bill 5079 a path towards better access to healthcare in tribal settings throughout the state. And so they are now working in tribal areas. What this bill does is addresses the disparities in access to healthcare by allowing dental therapists to practice under the supervision of dentists and limits them to federally qualified health centers or situations that look like that. They are mid-level providers that are highly trained in a narrow scope of practice commonly needed in dental procedures. This bill passed the House of Representatives. It is now in the Senate Long-Term Care Committee and has a hearing scheduled relatively soon. That's dental therapist.
Well, thanks, Ron. And Ron has been adding comments about each bill as we're going along, some of our legislative our policy committee actions and opinions. So you can read that in the chat. And so, Denny, are you ready to share your wise voice about the Keep Our Care Act?
My voice has never been wise, but most of us have been hearing about the various mergers where either the rich people have bought up hospitals and have turned them into a generating of money, but also religious organizations have bought various hospitals or merged their hospitals with some of the hospitals, oftentimes rural hospitals that are in desperate need of rescue. But one of the things that we've been noticing with those mergers is that the services, the care of the patients has gone to the lowest level instead of the highest level. Many of the purchases or mergers have ended up causing the loss of some of the benefits that people in the other hospital might have expected. Usually it's in the area of abortions, reproductive care, gender identity, end-of-life care, things such as that. Oftentimes when they're picked up by some of these larger or different hospitals, they end up sacrificing some of the benefits that they had at the other hospital. Well, this legislation, 5241, Senate Bill 5241, was intending to, and I'll read this, the healthcare mergers, acquisitions, and contracting affiliations must improve rather than harm access to affordable healthcare, end of life, reproductive care, gender identification. And sadly, this bill didn't make it through the cutoff that Lonnie was talking about. It had to get out of the Senate today, and it didn't. That doesn't mean it can't come up in some other form. They can oftentimes attach it, but in most cases, it means they'll have to try harder next year. But we were very supportive of trying to not have these mergers or acquisitions cause a reduction in care for the patients. What we do recognize as Healthcare for All Washington is that many of the hospitals, especially in the rural areas, they desperately need help. And so we would support and want to support the type of care that they can get that would allow them to continue in the rural area and provide all the services that the patients in that area require, and not be acquired by some giant richer hospital and then end up taking a step backwards.
So that's certainly a short version, but a wise comment about it. That's something we all are working in favor of. So thanks, Denny, for sharing that. I wanted to close out with comments about a couple of behavioral health bills. When we talked to legislators before session this year, they all emphasized that they know the need for improving behavioral health services in the state. And there are still several bills that are being considered. One of the bills that actually passed the House unanimously, I don't know how often that happens, was improvements in the 988 call. This bill is a House Bill 1134, and it does add some funding to educate people about the availability of that system and an alternative to the 911 system, and about and some funding to improve or expand that 988 system, as well as other crisis facilities across the state. So this is an important bill. How often does it happen, Lonnie or Denny, for a bill to be passed unanimously?
Usually rarely. The only time it normally passes that way is if there's a star football team that came in and were honored by the members of the House or Senate. Very rarely do you have unanimous, unless it is a fairly straightforward statement of loving everything and wanting to support everything. But that is a surprise.
Lonnie?
Well, I've seen quite a few of them this year, maybe 10% of all the bills that have so far passed unanimously through one chamber. Often, as Denny knows, something that seems like a good idea to the House might not seem like such a good idea to the Senate. So it's a bigger trick to get all the way through unanimous.
Yeah. Well, what they say is that almost 90% of the votes you take are not the kind of votes that someone's going to be afraid their constituents would be opposed to. They're just normal things, improving legislation that might have already passed, or some good deed that they would mostly agree to. But it is rare that you'd have any controversial piece or meritorious piece unanimous.
So, Lonnie, is there other mental health bills that are behavioral health bills that we are going to see passed at this session?
Yeah, I think that one really innovative bill to help address the biggest problem in behavioral health is the fact that we just do not have enough providers. And Senate Bill 5189 passed the Senate, and it would create a new category of behavioral health practitioners called behavioral health specialists. And it's already through the Senate and has a hearing in the House this Friday, which is a very good sign. And actually that committee has scheduled it for executive action. So creating the new category and getting that up and running will take a little bit of time, but it will really, I think, do a lot to help the current batch of providers that we have out there be able to share some of their workload with these specialists and see a lot more patients that way. So it's not the only answer we need, but it is significant. Maybe the most significant thing in terms of expanding practitioners that we've seen in several years.
And there certainly are regulations in our state that are different than other states as far as licensing. So having this special category is a powerful addition, but there are some other minor changes that are going on or tweaks, so to say, that can make a real difference in moving practitioners up into the front line to start providing care. So there are some great things going on. So those were the major groups of bills. If you have questions about any of those or about the information we've provided, so please go to the chat and add your questions. We have a link to our website in there to make donations, to find out information on our bill, and there are links to other organizations, our healthcare allies that are working on these issues. So there are several things that we can do and can move forward. So Lonnie, as we gather questions, do you have anything else to add?
Well, only that it's really, if you haven't actually ever, written to your legislator, and I bet almost everybody on this meeting tonight has, but who they like to listen to are their own constituents. You have a lot of power as a constituent. So I do, if one of these bills really interests you, please do, contact your legislator. And when we send out another request to weigh in on the budget, we really need your help with that. It is not an easy budget year. So I appreciate people taking an evening just to hear about all of this and to take action.
So I'm running through the chat to pull up questions, and I saw one a second ago and I've lost it. So one quick question is cut off strictly at midnight tonight, or was it at 5 p.m.?
Great question. It's a trick question, really. Technically, they had to end at 5 p.m. today, but there's this little workaround in the rules that allows them to start a last bill before 5. And if they do that, they bring it up, finish whatever they're doing before that, and then return to it at 5. And they can go until midnight. They are in the House doing a gun control bill, 1240. They have been working on it since just after 5 o'clock, and they are on final passage now. They have many amendments, and they have to have that vote completed before, by the time the clock strikes midnight. So technically 5, and yet one bill can go beyond that.
Yeah. One of the funny things they did at one time is someone stopped the clock so that it never reached midnight, or at least not until they got done what they wanted to get done. But that's not going to happen again, I hope.
I believe they don't allow that anymore, Denny.
That was fun when it happened.
So I saw one question about someone communicating who had communicated with their provider, with their legislator, and had some questions about the legislator's response. Here's one other question while I'm searching for that one is, what about residential behavioral school scandals in Washington State? The Seattle Times has reported that some of the schools are having problems. I'm not familiar with that.
Residential school, like deaf and hard of hearing schools, or are we talking about this developmental? You know, there's been, I'm not aware of a current scandal, but it might be because I'm just not focused on this issue.
Linda,
now.
Can you clarify that question?
I will say that the committees that would most likely be discussing those would be the Senate Human Services Committee and the House Children, Youth, and Families Committee. So I'm happy to see if they are discussing that and get back to you, Linda, because it's possible, it's more than possible, you know, they have, seems like every year more committees, and so I'm not actually in every one of them, but so I'm sorry, I don't know the answer to that right now.
Well, let's, if there aren't, I don't see any more questions hidden in there. I hope I'm not overlooking or ignoring someone, but Lonnie, thank you so much for your work in helping move us forward. It's been an exciting year to see things happening. Even the bills that are not passing at this moment still have breath to come together or to be passed in the second part of this biennium. So thanks for all your work there. And thanks to all the members of the policy committee who helped give us this overview. Ron, let's bring Peter up to talk a little bit about participating in Spotlight Peter Lucas to join the conversation here from Mexico.
Well, thank you, Ronnie. I'm sure this is the part of the program that everybody's been really looking forward to. I'm Peter Lucas. I'm a practicing psychiatrist and board member and treasurer. So it's apropos that I should bring this up. This is the fundraising portion, and just want to say we're all very pleased that so many showed up tonight to learn about healthcare legislation. And our organization, Healthcare for All, has played an integral role in bringing about many legislative victories in Olympia, some of which were discussed tonight. We helped to establish and appoint members to the Universal Healthcare Commission, and this group, which is still meeting, could craft a publicly financed universal system based on our bill, the Washington Health Security Trust. But in order to maintain our momentum, it is vitally important that we grow our membership, educate the public, and mobilize our supporters to spread the word to their family, friends, and most importantly, their legislators. And we can achieve those goals through social media, monthly webinars, such as tonight's excellent presentation, meetings with civic groups, and by hosting other events. And we are very pleased to have working for us an experienced and dynamic lobbyist, Lonnie Johns-Brown, who presented tonight. And we also have a communications specialist. These dedicated persons and activities, such as our monthly webinars and outreach efforts, all require financial support. And that is why we are asking you to donate tonight. As stated earlier, our goal is $250 tonight. So please go to the links in the chat or our website and click on the donate button. You can make a one-time donation, but we would especially appreciate it if you could make monthly recurring donations to provide consistent and dependable support throughout the year. So please donate so we can spread our message and bring about universal, publicly financed healthcare in Washington. That is the moral imperative. Thank you.
And thank you, Peter. And I already thank the people in the Political Action Committee who you met tonight. There are other members who are unable to join us. So if you are interested in working with this group, with this committee, go to our website, click on that Get Involved button. Let us know that you're interested in joining us, either in this committee or in other activities. Want to thank the people that are involved in other activities. Rich Legou, who is working behind the scenes to help us online. D.W. Clark, who's working behind the scenes in communications and in tonight's program. And Ron Lovell. Ron, you did a great job putting out information in the chat. So I think that's very useful and helpful to everyone. And of course, thank each of you. You wouldn't be here if you weren't participating already. If you can participate with a small donation, that's great if you're able. If you can participate with time, that would be great also. Go to our website, look at those options, review what we presented tonight, and join us. So with that, I can check the chat one more time, but I don't think there's any more specific questions that have come up. So thank you all for joining us tonight, and we'll see you next month at our upcoming Second Wednesday speaker series. Good night.